And with wisdom, she has given her dog ear.
I feel weird not touching the podium. Good evening. Thank you for joining us tonight. My name is Amanda Monholland. I'm the Acting Public Information Officer for the Shawnee County Health Department, and I am also on the Topeka and Shawnee County COVID-19 Public Information Response Team. Starting today, March 26th, there will only be one public information officer, and speakers will be limited to 2. Members of the media will be limited to 1 person per outlet. Sorry, correction, 2 persons per outlet. The Safer at Home order is to keep everyone safe, so please stay at home. During the Safer at Home order, finding things to do can get challenging as the days progress. So here are a few things to keep you busy. Take a long walk, go for a jog, or a bike ride. As always, please practice social distancing of at least 6 feet. Cook a new meal and share your recipe with others via social media, or sit down and do a puzzle. But most importantly, we need to maintain a positive attitude and keep a consistent schedule. So with that, I'm going to go ahead and introduce our speakers, Health Department Director Linda Oakes and Mayor Michelle De La Isla. Linda?
Thank you, Amanda. Good evening. Tonight, we have 33 pending cases, 241 negative tests, 145 monitoring, and we have now 4 positive cases. Our latest positive case is a female, 49 years of age, and she does have travel history out of the state. A couple things I want to talk about tonight. As with any time we have incidents, we have fraud. So I just want to make sure everyone understands you should not order a test kit for COVID-19 online. You cannot do that. It doesn't work. Be careful about fundraising. And I'm still getting many phone calls that my Social Security number has been compromised and there's a warrant out for my arrest. So they know where I am. So please be sure you're watching the fraud. It's always there. Unfortunately, people will take advantage of these situations. The blood banks still need blood donations. So if you can donate blood, please contact your blood bank and see if you can set up a time. They are working it out so that there's not too many people in the building. They know what to do. So please, if you can donate, please reach out. We still have that need. And in fact, that need is higher right now. So another request we have is that we can receive donations of certain items that we are needing for our healthcare and first responders, our critical infrastructure. So those are cleaning and disinfectant supplies, hand sanitizer, and personal protective equipment such as gloves, masks, gowns, and eye protection. So I'm really talking to schools and businesses that might use this, but now they're closed, so they can't use it. If you have those kind of donations, please send in an email to COVID-19 info, all one word, COVID-19 info at snco.us and put donation in the subject line. And please don't drop it off anywhere. We will talk to you after we get that email and make those arrangements. So that would be great. A couple of things I want to talk about with the Safer at Home order. All the golf courses will be closed at close of business tonight. Golf on the golf courses is not allowed in the order. Just want to talk to a little bit about what is essential. So essential services are life safety things. So we would like folks, well, we're asking and ordering folks that when you need to go to the grocery store, get in there, get what you need for essentials, and get out. We don't want people lingering. It's not the time to shop. You just need to get in there and get what you need and get out. If you are over 60 or in the other high-risk categories with underlying health conditions, try using the pickup or delivery. Try to stay out of the stores as much as you can. We really want people to look at the spirit of this order. We're trying to keep a virus from spreading in our community. So please, please take a look at what you're doing. Make sure it is essential. And I think the ideas that Amanda had for things to do I took a great walk today. Take a walk, take a bike ride. It really does help make you feel better when you do those things. Even if you're not used to walking, just walk a block. It's a great time to start that walking program. So, but again, only walk with your household members. Don't congregate in groups because that's going to spread the virus. And maybe you can weather the virus fine and you just have some mild symptoms, but the next person, it could be fatal. So we want to make sure that we're protecting the people that need protecting in our community. One last thing, we have a new service on our website, and this is the Shawnee County dashboard. So this is our dashboard for our community that the health department is providing. We will be updating it at least twice a day during the week and once a day on the weekends. So if you want to know about our cases, about how many tests we've done, you can go to this. It's off our webpage, as you saw, Amanda pulled it up. And it also lists the websites that you can go to for information. So we really are excited to have this information available for you. And our GIS department here at Shawnee County helped us develop this. So I really appreciate that. And that is all I have. Mayor.
Well, team, we have another case. As Director Oakes indicated, it's a female, and if I recall right, around the 50s, the age? 49. Okay, 49 years of age. Please stay home. I don't know how else I can emphasize this. Please stay home. We have been working extremely hard to make sure that we are absolutely transparent, so much so that now we're even putting the information that we're giving out to the media. But we're trying to figure out and as a team analyze how often we're going to keep doing this because we don't want to burn you guys out. And most importantly, because we want to make sure that when we are calling you for a press conference, that we're calling you for a press conference as something that we can talk about. Now, that does not mean by any stretch of the imagination that we will not remain accessible to all of you as new things develop. But I think that as a community, I'm very proud of our team that has worked so hard together to make sure that we have been always one step ahead of every issue that we're seeing happen. But at this point in time, we know that the biggest things that we could do have already been done, which is how far we would go with what we would impose on our community with regards to safety. And then the other thing is us figuring out how many, if we were going to have a case, and actually now we have cases that are active. So please stay home. We'll figure out how to keep communicating. Our Facebook Lives are still going to happen. We're still going to have tomorrow's press conference. Pending that there is no change, we more than likely will not have the weekend press conferences. So yay, you guys get a few hours extra on the weekend. But we will keep talking with you. Please do not think that this means that we are not going to continue talking. So let's go into Spanish. La dama que empezó habló no solamente sobre las cosas que usted no puede hacer, pero sino que estaba dándoles ideas a todos de las cosas que sí pueden hacer. Por ejemplo, pueden hacer un rompecabezas en su casa, pueden jugar juegos de mesa con sus hijos, pueden ir a caminar, pueden ir a dar una corrida, pueden correr su bicicleta. Pueden hacer muchísimas cosas. Hoy el día estuvo muy bonito y era un día perfecto para que saliéramos de la casa. Referente a los casos que tenemos activos, hoy tenemos un caso nuevo. El caso nuevo es una dama de 49 años. La señora viajó fuera de la ciudad de Topeka, así que sabemos que ella lo contrajo porque estuvo en contacto con personas fuera de la ciudad. Ahora tenemos 33 casos pendientes, 241 negativos, y tenemos 145 personas bajo observación. Hoy el consejo de los concejales del condado decidieron que los campos de golf van a ser cerrados al público. No solamente los públicos, sino que también los privados. Estaban las personas todavía juntos jugando golf, así que hemos tenido que tomar la difícil determinación de que eso es lo mejor para mantenerlos a todos seguros. Si tiene más de 50 años, se lo hemos dicho varias veces, pero por favor no vaya a hacer compras. Llame vaya online y pida la compra y recójala, o pida a alguien que vaya y que le haga las compras, pero por favor trate de no salir, porque este virus es muy feo y necesitamos la cooperación de todos ustedes para que nadie más se nos enferme. Quiero recordarles nuevamente que si tiene preguntas sobre el coronavirus, sobre la ordenanza, si tiene preguntas de cualquier cosa, puede llamar al departamento de emergencias del condado y el número es 785-251-4848 y el email es covid19info@sncco.us. Básicamente covid-19info@sno.us. Queremos decirle que tengan mucho cuidado, porque en momentos como este hay gente que se quiere aprovechar de las personas. Y no pidan test online. Por favor, no pidan los test que están vendiendo en el internet, porque esos test no funcionan. Así que por favor, no hay ningún test que usted pueda hacerse en la casa. Tiene que ir al médico y tiene que ir al hospital. La otra cosa es que si usted puede donar sangre, el banco de sangre, la Cruz Roja, está buscando para personas que estén donando sangre. Y estoy viendo, y entonces sí estamos recibiendo donaciones, pero las donaciones son de cosas para desinfectar, batas médicas, guantes y mascarillas, pero no las mascarillas hechas en casa, sino las mascarillas que están hechas por el doctor, o sea, las que están ya manufacturadas. Así que eso es todo lo que tenemos para todos ustedes. Por favor, ya nos están creciendo los números de personas infectadas en la comunidad. Tome esto muy en serio. Sinceramente, tómelo en serio. Cuide de sí mismo, cuide de su vecino y por favor, vamos a mantenernos sanos. Lo último que voy a decir es que nosotros decidimos que no vamos a ir a seguir haciendo esta conferencia de prensa cada día. Mañana va a ser probablemente la última, pero ya básicamente nos preparamos tanto para esto que entendemos que ya si hacemos otra conferencia de prensa para que todo el mundo esté seguro, lo que vamos a hacer es si algo grande pasa. Aquí vamos a tener una página en el internet que está en el Shawnee County Health Department, que usted va a poder ver todos los días los números que doña Linda le da todos los días, y aquí están todos presentes y se van a mantener al vivo todos los días. Estos números van a cambiar a medida que recibamos información. Y básicamente eso es lo que todo el mundo está buscando, a ver qué es lo que está pasando. Así que gracias por estar aquí y hablaremos pronto, hablaremos mañana y luego de eso nos comunicaremos luego.
Okay, so now we'll go ahead and open it up for any questions.
Some people are wondering, can you clarify why you guys have on your list that driving is not essential? Can you just clarify
Sure.
driving to certain places?
Yeah, Linda's going to cover that.
So the order states driving for essential services only. So Sunday drives are not essential. And so it puts cars on the road, it puts people at risk for accidents that can tie up our emergency responders. And I realize the odds of that are low, but still we want to make sure we're not exposing them. So again, we only want people out for essential services, and that's not essential.
Other people are asking questions about essential businesses like gun stores. Osage County has their gun stores open. So what are your thoughts on that? Is that a different interpretation on keeping the gun stores open?
The gun stores are open here too.
And I guess some people are wondering why is that essential other than other businesses?
The gun stores provide services to our law enforcement officers. I think that would be the main reason.
Some people have questions on, are we running out of hospital beds at local hospitals, and are you guys going to reach out to VA hospitals to try to open up their beds, so the overflow?
We are working with the VA hospital in this whole event, in this whole pandemic event. Right now, I'm not aware of the hospital running out of beds.
Could you talk a little bit about the new confirmed case? Is that person, had they been in contact with the other cases?
No, they had not. So this person had traveled out of the state. So.
And could you talk a little bit, I know we're a little far off that, but how is the process of determining if someone has recovered from COVID-19? Do you just wait a week after they've shown any symptoms, or kind of explain a little bit about that?
So right now, the guidelines are either 2 negative tests 24 hours apart, which we know is not very practical right now because we don't have testing. So the other would be 7 days or 72 hours fever-free without fever-reducing medication, whichever is longer.
Are you guys still being active with your question and answer real time on your Facebook page? Or are you guys able to answer all the questions?
We're trying our best to stay up, yes.
And so for these confirmed cases, is it up to the hospital to see if they will stay at the hospital, or can they determine if they can go back to their home and be isolated there?
It'll be up to the hospital to see if they are able to be discharged medically, and then we will be in contact with them if they're recovering at home.
And if so, if the person calls you and says, I've been feeling good for 3 days, would you go in and check on them, or just take their word for it, or how does that work?
So again, it's 7 days, and that whole 72 hours fever-free without fever-reducing medication, whichever is longer. If there's any question, we refer back to their primary care provider.
Is there a plan to go physically check on them, or just once we know that?
We could. We don't have a lot of PPE either, but we do have some, so if we needed to, we could.
Is there some type of fine or anything for people who are out doing things, or would they be questioned just by doing their whereabouts? Because some people might get confused again, just what are essential to them and what might be essential to you.
So my understanding right now, and the sheriff is here and he can correct me if I'm wrong, is that if you are pulled over, if you're speeding, you'll probably get a speeding ticket, and the officer can ask you, can you tell me why you're out? It would be more of a friendly conversation. There's no requirement for paperwork or work badges, even though we wear ours, you know. So, and I believe that is still correct. Correct, Sheriff? Thank you. Okay.
Oh, I'm sorry, can you tell us where the person is being treated at? Which hospital? Are you able to say?
Person is at home.
Person is at home.
Mhm.
Okay, so just one more time, I'm going to echo what Linda said earlier in the press conference and remind you that we have the COVID information email, which is COVID-19, no spaces, COVID-19info at snco.us. And the hotline for businesses to call if you have questions about your infrastructure and your essentialness is 785-251-4848. And with that, thank you guys. We'll see you at 5 o'clock tomorrow.